At Community Measurement, we've been doing quality measures with physician offices for about the last 6 years. And it was really fun this past year. I got a call from Dr. Chris Tashian here in Ellsworth, Wisconsin. He said they were going to make some changes to their small practice here in Wisconsin that they thought would really improve the results for the patients in their community. And I was a little skeptical, given that we have 400 and some groups that we're doing measures on, that they would have significantly improved results. A few months later, Chris called and said they thought they'd done it. And this is just a very interesting story of what they've done with just the resources that they have to engage their staff, to engage their patients, to get significantly better results.
We knew that healthcare is changing. We knew that there were things we could change and things that were beyond us. And one thing that we could change was the care we deliver in our clinic. That was 100% within our control. We couldn't control some of the other costs, but we could control the care. So we set out to say, how do we provide the best care, measure it, and give our patients what we think they deserve, the absolute best.
Well, I think initially I started to do some simple chart reviews on patients with chronic diseases and looking at their data, making sure that their patients were taking the right medications, making sure their labs were up to date and were in acceptable ranges, well controlled, whether that was their cholesterol or their diabetes, et cetera, their blood pressures. And then that was part of a process that the clinic developed to have the staff take a look at the charts before the patient would arrive, either the day before if possible, if it wasn't a same-day appointment. Take a look at the services that they would need, not only for the chronic diseases of diabetes and coronary artery disease, but also to see if their cancer screening was up to date, if their immunizations were up to date, so that some of that work that could be done beforehand would be done when the patient came, so that they could have everything taken care of at one visit while they were here. We also involve the front office so that the time the patient calls and makes an appointment, that enough time is allowed for an appointment to deal with other issues that may arise rather than just a sore throat or an earache that they may have addressed as a need for the visit.
And we have a flow sheet that we use so that when they do come in, we don't forget to ask them all these questions. We ask them if they've had their general questions, like if they've had their mammogram, their tetanus shot, their pneumonia shot, which is very important for heart disease and diabetes again. And we can follow through with that by looking on the sheet each time they come in. We go down this list, and the doctor also can see at a glance if they're up to date.
Another thing that we did was we instituted some standing orders for labs. There would be patients who'd come in for a test to measure the levels of a blood thinner. But our lab staff and our clinical staff were empowered to scan through their charts to look and see what other labs did they need and what can we get done on that day at the visit. And patients appreciate that very much, to try and make it consistent, make sure that we're being as efficient as possible. But it also helped make sure that we were keeping up with those routine labs that sometimes otherwise would have gotten missed.
I am the coordinator of our diabetes education program for our whole set of clinics. When we're on site, they're much more willing to come. This is their clinic, and I think that increases the number of referrals that we see and the number of patients that come in for that education. And then we like to see them once a year for follow-up, which doesn't always happen, but we're trying to make it happen more often, because the studies show that people with diabetes do better when they see an educator on a yearly basis and come in and get coached and get remotivated and that sort of thing.
I always say that I'm a wonderful nag, getting patients in here when they need it, and just kind of a support person. Sometimes I'm just a counselor for people who are having diabetic fatigue. They're tired of having their chronic diseases, and they just need kind of a support person, kind of like a cheerleader, to call them and support them and encourage them.
I think it's important to understand, when it was a physician-owned problem, we did well, but we plateaued and we really couldn't move to the next level. When we brought in our staff, and we made them part of the equation, we really excelled and actually moved beyond the next level and really did well.